I'm Dr. Sabrina Sghirripa and I'm a postdoc here at the Australian Institute for Machine Learning and at SAHMRI. So I'm a cognitive neuroscientist interested in understanding how the brain ages. So it's a gift to grow old, and we have many life experiences, both good and bad, that shape us into who we are. But a lot of those experiences can dictate whether we develop dementia or not. And part of our work is to understand what experiences lead someone to be protected versus someone who might be at risk of developing dementia in their old age. Obviously, we have an aging population. Dementia is massively prevalent, millions and millions of people being diagnosed per year. So in order to stop that, we need to make sure that people stay healthier, live longer and healthier lives. And I use these neuroimaging and EEG type techniques, so measuring either brain structure or brain function as well as brain rhythms, to understand how the brain works when we do cognitive tasks like memory tasks and reasoning and understanding. So I am lucky enough to be funded by the MRFF, so my position is funded as part of a broader dementia MRFF project. So probably one of the biggest achievements we've had in the past few weeks was a partnership that we've developed with a local dementia carer organisation. So dementia caring, I suppose, is a very good example of a really stressful and intense life experience. Obviously it has its beauty as well, but people who do care for someone with dementia, in this case I'm talking about a spouse or a family member, are at a greater risk of developing dementia themselves. So we're interested in understanding what can we do for these people, how can they change their activity patterns, do certain things, whether that's socialising, being part of peer support groups, to help protect their brain and cognitive health. So it helps me use my neuroimaging expertise with something that's on the ground. I suppose I may be a bit of an odd one out in this building in the sense that I don't do AIML research myself. I'm a neuroimaging scientist, and being able to be in this building means I have access to so much expertise that I personally don't have, but also being able to provide expertise on the idea of how do we actually apply these things, like what might be biologically relevant, and sometimes it's how can we take that pie in the sky idea and actually turn it into something that might be relevant for the real world. I love the students around AIML, I love the colleagues around here having such stimulating discussions. Sometimes I feel like a bit of a grim reaper talking about that will never work, but I think that's part of what makes this field so exciting, is how do we take these ideas and transform them into something that could be used in the clinic or to help people in society more broadly. So I think I'm most inspired by just the older adults that live among us in society. I'm very close to my grandparents, and they have played such a role in shaping me into who I am today. And to ensure that people can not only live well and enhance their own well-being as they age, but to give people the gift of being able to experience their family members for longer, and give people the gift of time and help people live lives that are enriching and so they can thrive as they get older. It's not only about the older person themselves, but society benefits so much by having the expertise of older people. So if we can keep them healthier and happier for longer, it means we can benefit from their expertise for longer.